expecting a resurgence of coronavirus cases. Today, the state reported at least 400 new cases for the second day in a row. State Health Commission Dr. Chris Box said in the last month, the Delta variant has accounted for more than half of the new variant cases they've been seeing. She had a warning for the unvaccinated.
If we start to see significant increases in cases, and we will see a surge of the Delta variant, I will be like other countries and other states that have seen this. People will need to be very careful if they're unvaccinated and continue to wear their masks on a regular basis to protect themselves and their family. I think that we are not planning any further restrictions at the state level, but individual communities and schools in consultation with their local public health may decide to make different decisions based on the level of infection at that time.
There's been a lot of updates to keep and count for. Starting with this one, teachers and students can drop the mask inside schools. That's if they're fully vaccinated. The CDC relaxed those guidelines today, saying in-person school should be a priority this fall. The agency doesn't suggest schools require shots for teachers and vaccine-eligible kids. It also is not offering guidance on how teachers can know which students are vaccinated or how parents will know which teachers are vaccinated. The CDC does say that schools should continue spacing desks at least 3 feet apart.
Meanwhile, federal health officials say they're not convinced that you'll need a COVID-19 booster shot, at least not yet. Pfizer announced yesterday that it will seek approval for a third vaccine dose. The company says its tests show a person's antibody level jumps after the third dose. They also call that important as new variants spread in the United States. So we asked our medical expert, the former Surgeon General, Dr. Jerome Adams, what to make of the seemingly conflicting positions.
What I want people to understand is that Pfizer's looking at where the hockey puck is going, to borrow a Wayne Gretzky analogy. They're looking at the fact that come winter, we may need a booster shot, particularly for older people going back into nursing homes who were among the first to be vaccinated. They've seen that from their studies, the antibodies are starting to wane just a bit, particularly in that population. The FDA and the CDC, however, want us to focus on where the hockey puck is right now. And right now, the vaccines we have are still highly effective at preventing hospitalization and death. They're still our best protection. So get vaccinated now if you aren't vaccinated yet, and stay tuned because there may be a need for boosters in the future. But if we all get vaccinated and we can get this virus to go away, then no one's going to need a booster.
A joint statement from the FDA and CDC says more data is needed before deciding on potential vaccine boosters.